Americans spend $4.3 trillion on healthcare every year, but most couldn't tell you what a single aspirin costs at their local hospital. Ever wonder why your medical bills look like they were encrypted by the CIA? Today, I'll break down how medical billing really works, simply. By the end, you'll see why hospitals hide their prices and how being uninsured can sometimes save you money. Here's what nobody tells you about how hospitals actually set their prices. Ever wonder why medical bills seem completely random? Hospitals inflate fake prices in a secret chargemaster list, then let insurance companies negotiate huge discounts. The catch? If you're uninsured, you pay the full fantasy price. This chargemaster can span thousands of pages and contains the official cost for everything from band-aids to brain surgery. Here's where it gets wild. These prices are completely fabricated. A single Tylenol pill might be listed at $37. An ice pack could cost $85. A basic blood test that costs the hospital $12 to run might be priced at $400. But it gets even more absurd than that. Some hospitals charge $15 for a single latex glove. Others bill $53 for a mucus recovery system, which is literally just a box of tissues. One hospital in California charged $629 for a pregnancy test that costs $1 at a drugstore. These aren't isolated incidents or billing errors. They're standard practice across thousands of hospitals. There's no formula, no cost analysis, no market research driving these numbers. Hospital administrators literally pick figures that sound profitable to them. They meet in boardrooms and decide that, yes, a $37 Tylenol seems reasonable. The justification? They claim these inflated prices help offset costs from uninsured patients who never pay. But that logic is circular. They're overcharging uninsured patients to make up for uninsured patients not paying. Insurance companies negotiate massive discounts off these inflated amounts. They might pay just 20% of the listed price. So that $37 Tylenol becomes $7 for the insurance company. That $629 pregnancy test becomes $125. The $400 blood test becomes $80. Insurance companies know the game and refuse to play by chargemaster rules. But here's the kicker. The people who can least afford healthcare, the uninsured, pay the highest prices. They get hit with the full chargemaster amounts that nobody else actually pays. A person earning minimum wage with no insurance pays more for the exact same aspirin than a millionaire with premium insurance. That's how the system quietly punishes the uninsured. It's not confusion, it's a business model. So that's why hospital pricing seems insane, because it is. Now let's talk about why sometimes being uninsured is actually cheaper. Wait till you hear this part. It flips everything upside down. What if I told you that having insurance can cost you more money than being uninsured? Many hospitals offer cash discount programs for uninsured patients. They'll take that $400 blood test and offer it to cash patients for $60. Why would they do this? Because $60 in cash today beats $400 they'll never collect from someone who declares bankruptcy. It's basic business math, even if it makes no moral sense. Hospitals would rather get something than nothing. So they slash prices for people paying out of pocket immediately. What most people don't realize is that if you have insurance, you often can't access those cash prices. Your insurance company has a contract with the hospital, requiring you to use your insurance benefits. So you might pay a $200 copay for that blood test, while the uninsured person beside you pays $60 cash. Real example from Texas. A woman needed an MRI for chronic headaches. Her insurance copay was $1,100. She asked the imaging center what the cash price would be if she didn't use insurance. They quoted her $600. But when she tried to pay cash, they told her it was illegal because her insurance contract required her to use her benefits. She paid $1,100 for a service that cost $600. You'd think that's the end, but it gets worse. Here's the loophole hospitals don't want you to know. People are literally better off not using insurance they pay thousands for annually. Some savvy patients have started hiding their insurance cards and claiming to be uninsured to access cheaper cash rates. I've heard stories of patients asking to pay cash for procedures and being told they legally cannot because they have coverage. It's like being forced to use a coupon that makes everything more expensive. The system actually penalizes you for having insurance in certain situations. Imagine buying a gym membership and then being charged extra fees every time you use the gym. That's the real game changer. Insurance can make you the highest paying customer. This leads us to how billing complexity keeps you confused on purpose. Now here's where the system really gets twisted with billing complexity. Why does every medical bill look like it was written in ancient hieroglyphics? Medical bills combine legal jargon, medical terminology, and accounting mumbo-jumbo deliberately. They're designed to be incomprehensible so you won't question the charges. You'll receive multiple bills for a single hospital visit. One from the hospital facility, another from the emergency room doctor, a third from the radiologist who looked at your x-ray, maybe a fourth from the laboratory. Each bill arrives at different times, uses different coding systems, different pricing structures, and different payment terms. Here's a real scenario. You go to the emergency room with chest pain. 3 weeks later, you get a bill from the hospital for $2,800. 2 weeks after that, a separate bill from the ER doctor for $950. Then another bill from the cardiologist who reviewed your EKG for $340. Then the lab that ran your blood work bills you $425. You thought you were getting one service, but you're paying 4 different companies. This fragmentation makes it nearly impossible to shop around or compare prices. Try calling a hospital and asking how much a knee replacement costs. You'll get transferred 17 times and eventually be told they can't give you a price without knowing your insurance information, your medical history, and possibly your astrological sign. The billing codes themselves are intentionally confusing. Medical providers use CPT codes. There are over 10,000 of them. One code for a routine office visit. Another code if the doctor spends more than 15 minutes with you. Another if you discuss multiple health issues. The difference between code 99213 and code 99214 can mean hundreds of dollars in charges. Most doctors don't even fully understand the coding system they're billing under. Now check this out. Insurance companies aren't innocent victims in this scheme. They benefit from the complexity because it allows them to deny claims and shift costs back to patients. That's why you get bills months after your treatment for surprise charges that weren't covered for mysterious reasons. Prior authorization is another tool for denial. Your doctor says you need an MRI, but your insurance company makes you get approval first. They assign someone with no medical degree to decide whether you really need it. This person reviews your case for about 90 seconds and often denies it. Your doctor has to appeal, which takes weeks. Meanwhile, your condition might worsen. If you need the MRI urgently, you pay out of pocket. It's not confusion, it's a business model. And that's the missing piece. Confusion is profitable for everyone except you. Which brings us to how this system makes you avoid the doctor entirely. Here's how it all connects to why emergency rooms are packed with preventable cases. What does this mean for your actual health and wallet? When you never know what something will cost, you start avoiding the doctor altogether. Preventive care becomes financially terrifying, so people wait until emergencies force them into the most expensive care settings. This training happens gradually and unconsciously. The system creates the exact opposite incentives from what would actually keep people healthy and costs low. A routine checkup might cost $100 or $1,000. You won't know until weeks after your visit. Why would someone risk a mysterious bill for preventive care when they could just hope for the best? Think about what this does psychologically. You notice a weird mole on your arm. In a normal system, you'd get it checked immediately. In our system, you think about your deductible, your copay, whether the dermatologist is in network, whether you'll need a biopsy, what that might cost. So you wait. You monitor it yourself. By the time you finally go, it might be stage 2 melanoma instead of a simple removal. What most people don't realize is that medical billing companies have become a massive industry unto themselves. Hospitals employ armies of billing specialists whose full-time job is figuring out how to extract maximum payment from insurance companies and patients. These aren't people providing medical care. They're financial engineers gaming a broken system. The American Medical Association estimates that doctors spend $99,000 per physician annually just dealing with insurance company bureaucracy. That's not treating patients. That's filling out forms, fighting denials, and navigating billing codes. A typical doctor's office might employ 3 billing specialists for every 10 doctors. All those salaries get passed on to patients through higher bills. Healthcare spending in America is absolutely bonkers compared to other countries. We spend twice as much per person as other developed nations, but we don't get better health outcomes. Where does that extra money go? Much of it goes to the administrative overhead of managing this impossibly complex billing system. We spend more on billing and insurance administration than most countries spend on actual healthcare. That's how the system quietly bankrupts patients while enriching middlemen. That's why this matters. The system is designed to confuse you into overpaying. Finally, some good news. Change might actually be coming to medical billing transparency. Federal price transparency rules now require hospitals to publish their negotiated rates with insurance companies. It's early days, but patients are starting to discover the massive price variations between providers for identical services. A CT scan might cost $300 at one hospital and $3,000 at another hospital across town for the exact same procedure with the same quality. Some patients are becoming healthcare hackers, learning to navigate the system and demand better pricing. Medical billing advocates and patient representatives are helping people fight unfair charges and negotiate better deals. You can request itemized bills, question every charge, and negotiate payment plans or discounts. Here's what actually works when fighting bills. First, always request an itemized bill, not the summary, the full line-by-line breakdown. You'll often find duplicate charges, services you never received, or supplies billed at absurd markups. Second, compare the charges against Medicare rates for the same procedures. Medicare publishes what they pay for everything. If the hospital charged you 5 times Medicare rates, you have leverage. This part will make your jaw drop. Most hospitals would rather accept $500 immediately than chase you for $5,000 they'll never collect. Many will offer 30 to 50% discounts just for paying within 30 days. Some will write off entire balances if you demonstrate financial hardship. They have charity care programs they're legally required to maintain, but rarely advertise. The most frustrating part is that this entire system is completely unnecessary. Medical care costs money to provide, just like everything else. Doctors, nurses, equipment, and facilities all cost real money. There's no reason those costs can't be calculated, published, and charged transparently, like every other service industry on Earth. Other countries prove transparent pricing is possible in healthcare. In France, Germany, and Japan, patients know what medical procedures cost before they get them. In Singapore, hospitals post their prices online like restaurants post menus. Patients can compare and choose. Competition drives quality up and prices down. Surgery centers and urgent care clinics in America that post their prices online attract patients by offering predictability and reasonable costs. Transparency would eliminate the ability to price discriminate and hide massive profit margins. The power is shifting slowly back to patients who demand to know prices up front. Some employers are steering workers toward high-quality, low-cost providers by offering incentives. Apps and websites now help you compare medical procedure costs across different facilities. Tools like Healthcare Blue Book and Fair Health Consumer let you see what procedures should actually cost. The more people demand transparent pricing, the harder it becomes for hospitals to maintain their secret price lists. So here's the full journey. Medical billing is sneaky and non-transparent because the system was designed by people who profit from confusion. Chargemaster prices are fake numbers used to maximize revenue from the uninsured while giving insurance companies negotiated discounts. Being uninsured sometimes costs less because cash discount programs beat insurance copays. Billing complexity keeps you confused on purpose, so you won't question charges. This trains you to avoid preventive care, leading to expensive emergencies. The entire structure exists to extract maximum profit while providing minimum transparency. So what do you think? Broken bureaucracy or billion-dollar hustle? Have you ever gotten a medical bill that made absolutely 0 sense? Drop your story below.